One of the most well-known health insurance companies nationwide and in Southern California is United Healthcare, affectionately abbreviated to UHC. And one of the biggest and most popular healthcare systems in Southern California, specifically in San Diego, is Sharp Hospital. So having a plan that combines them both, the UHC Sharp Advantage plan, sort of gives you the best of both worlds. But here are 5 things to know about the UHC Sharp Medicare Advantage plan available in San Diego in 2025. I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is the best Medicare option for them this AEP, or really all year round, and live here in Southern California, give us a call at the information down below and we can help them to make those tough Medicare choices. Undoubtedly, one of the doctors and hospital networks our clients request most is the Sharp Doctors Network. Whether it is going to the big hospitals at Sharp, Reese, Steely, or even some of those smaller networks that are more kind of boutique doctor's offices that still fall under the Sharp family umbrella. Having a plan specifically dedicated to these networks means that there are no stones that get left unturned when a client wants to use the full Sharp network and doesn't want to have to worry about maybe only some of their doctors or specialists being in network or out of network. And it also means that there's much more certainty about getting to keep their healthcare providers they know and love at Sharp. And obviously, that is one of the biggest advantages to having a UHC Sharp specific Medicare Advantage plan. Next up, let's talk about one thing that can get folks really caught up, which is made very simple in this case, is the monthly premiums and deductibles. It is easy on this plan because of the fact that there are $0 for both. This means that beneficiaries will not have a monthly premium for this plan if they choose it in 2025, but they will still have to maintain their Medicare Part A, which is pretty easy because there isn't any cost to that monthly, but they will also have to keep their Medicare Part B, which does have a monthly cost. In 2024 is $174.40 a month, and in 2025, it'll likely be around about estimated $185. And I'll do a full video on that when the actual exact number becomes available. Ditto goes for the deductible as well, since it is $0. There will not be any initial costs that a beneficiary will have to pay before their cost sharing with the insurance company, that's copays and coinsurances, kick in. For this next benefit, the maximum out-of-pocket, or the MOOP, the limit on the UHC Sharp Medicare Advantage plan in 2025 is going to be at $3,400 per year. What this is the cost limit that Medicare beneficiaries will have in the year for their healthcare services under this plan. Once their cost reaches that $3,400 for their healthcare services, they will have hit their maximum spending for that year. Now, one thing to note on this is that the $3,400 does not include the cost for prescription medications, which in 2025 will actually have a max, will have its own separate limit for the year at $2,000 per year. But again, this is not included in that out-of-pocket maximum. Overall, $3,400 is not the highest of the MOOPs that are going to be out there, especially here in Southern California, but it is definitely not the lowest. It is probably, I guess I would call it, one of the most mediumest MOOPs available. Another really important thing to point out is going to be the copays on the primary care and specialist visits, as well as the costs for the optional virtual visits. The copays for primary care visits on the UHC Sharp Advantage plan is again very middling at $5 copay for the primary care visit. The specialist visits, I would say, are going to be on a little bit of the higher side of the spectrum at $35 copay for each visit. Now, I think it's important to understand that this plan is an HMO plan, or a Health Maintenance Organization plan. This means that there is an order of operations that generally has to be followed when utilizing healthcare providers. First, a person would need to go to their PCP, or their primary care doctor. Then, in order to get other services, whether it is a specialist visit or physical therapy or MRIs or EKGs, all those kinds of things, a referral is going to be required from that PCP, and also potentially prior authorization from the insurance company, which can make these types of plans a bit tedious, but ultimately a very good option if someone wants to balance the cost and the benefits of their health care. Oh yeah, and one last interesting vestige of maybe the pandemic is the availability of virtual visits with a doctor, which are at a $0 copay. So I think this is a nice benefit because of the fact that not all healthcare visits have to be in person or need an appointment. So, for example, if there's just a need to check on something, or if something feels off a little bit, these kinds of virtual visits can be a really good way to get professional advice about whether or not it's something that is concerning and immediately needs to be dealt with and go to the urgent care or worse, the emergency room, or it's something that could wait for a doctor's appointment later in the week. And for $0, I mean, why not give them a call, right? Last of today, and I think one of the real highlights of the UHC Sharp Advantage plan is the fact that it has an allowance for hearing aids for those folks who have a hard time hearing. Now, this benefit is counted as an extra benefit because hearing aids are one of those things notoriously not covered by original Medicare and are not covered under Medicare benefits. But under the UHC Sharp Advantage plan, if someone needs to get hearing aids and doesn't just have selective hearing, hi honey, I know, I'm just kidding. I always hear you and I love you. But yeah, if medically necessary hearing aids are required, there's a variety of hearing aids that are available from the less expensive at $99 all the way up to the top of the line hearing aids at $1,249. And although these copays do seem sort of high, realistically the cost for hearing aids is crazy high on their own, especially if you want to get like the Bluetooth and the ham radio transmitters and all the gizmos and gadgets that come with them nowadays. These copays are pretty good. And in fact, they cover 2 hearing aids that can be purchased every single year instead of having to have to wait double that, sometimes maybe even triple that, 2 or 3 years to get them replaced on a lot of other plans. So overall, it is a great benefit for those folks who need it. So when we look at UHC Sharp Advantage plans available in San Diego in 2025, I think there are some pretty important trade-offs. The plan is middling when it comes to price. The maximum out-of-pockets, the doctor's visits cost, and the totality of cost for services. But the reason folks would choose this plan is because they want to have a plan operated through one of the largest healthcare providers in the United States, that's UnitedHealthcare, and want to ensure that they can have the full accompaniment of doctors and facilities at the local level that are available at Sharp. And if this is the case, then this plan is sort of a happy medium choice. All right, so that's it for today's plan review of the UHC Sharp Advantage Plan 2025 available in San Diego. And if you or somebody you know wants information about this plan or really anything Medicare related, has some sort of Medicare quandary, feel free to reach out to us at the information down below and we can assist them over the phone or at one of our many offices here in Southern California in English or Espanol. So of course, I'm Michael and this is Michael's Medicare and I hope you have a great rest of your day and goodbye.